Instead of 50 hormones, we're going to concentrate on the top hormones, find a baseline.
Perimenopause is the roller coaster. Menopause is defined as the period where you have not had a period for 12 months. So say your body is a car, and in order for your car to start moving, we need gas in the tank. That's where hormone replacement therapy comes in. And that could be really life-changing for so many people. We shouldn't have to wait until women get so symptomatic that we're not helping them.
Arousal and orgasm. What's the science women should know that often gets left out of conversations?
It's biology. Men have like the Viagra and all these other medications. Women don't have quite as much, but that is changing. Talking openly. This stage in life for all of us women, it's so hard doing it alone. Don't be afraid to bring it up. Have that kind of safe relationship that you can talk about these things. Always ask questions. Go prepared to your visits, track everything. Push for a second opinion. You know your own body and you're the best person to provide that information to your doctors.
Welcome back to Dear Suga. I'm so glad you're here today. If you've listened before, you know we dive deep, no fluff, just real conversation that matters. So today, we're talking about hormones, menopause, sex, and the questions so many women quietly carry. And joining us is Dr. Tui Lauilefue. Dr. Tui is a double-boarded certified internal and obesity medicine, a Menopause Society certified practitioner, and the founder of Niuolah Health in Olympia, Washington. She's also a TEDx speaker and a passionate advocate for healthcare that feels personal, accessible, and deeply human. So, Dr. Tui, woohoo, welcome.
Yay! Hello, Miss Nani. Thank you so much for having me back on your podcast. And since our first one together, your podcast has just taken off. So I'm really grateful for this platform.
Thank you to you because you've been helping grow, is creating a community together. So I want to begin right where women meet you in the exam room. So research shows that only 18% of women ever bring up sexual health or menopause concerns with their doctor. So when women come to see you, what are the questions they actually ask? And what are questions you wish more women would ask about their hormones or overall health?
Yeah, excellent question. So as you know, because I am an internal medicine doc, I see, both men and women when it comes to women's health. This is something that has been like a slow progress as far as the advancement of women's health. In the exam room, specifically pertaining to perimenopause and menopause, women, they don't really bring things up. Maybe it's because I am a primary care doctor and maybe they're saving it mostly for their OBGYN, but when they do bring it up, it's usually things related to the cycle, whether it's, oh, hey doc, my period is getting irregular, or I'm skipping periods, it's getting shorter, heavy bleeding. Again, it's mainly around the cycle. And I think it's because a lot of women don't realize that a lot of the symptoms that they may be experiencing, they probably don't relate it to like hormones. They probably think it's whatever else is going on. But so many of these symptoms that present, like mood swings, you're having sleeping difficulties, feeling very fatigued, just have a lot of brain fog, so these are just a short list of symptoms. Most women don't realize that, yes, all of these symptoms could be related to those hormone changes. With your question about what do I wish women would bring up, and it's not so much because it's their fault, because if we're not educating our patients, if we're not educating women, like, hey, when it comes to hormone related changes, it's not just about your cycle, it's not just about things like night sweats, mood swings, a lot of the other systems are affected. So if we educate women that way, I feel like more women would then be able to recognize these symptoms and they'd be able to then bring it up for discussion with their doctors. Sexual symptoms too, when it comes to sexual health, that's rarely asked in the exam room. And historically, this has always been a very taboo kind of topic, but things like libido, vaginal dryness, orgasms, pelvic pain, a lot of these symptoms are very related to the changes in hormones. And I always tell patients, hey, If it's bothering you, then you should bring it up. It's worth bringing up so we can at least talk about it. Because if we don't know what symptoms you're having, I can't help address that.
And that's such an important perspective from your end as a doctor. And I think it sets us up perfectly for the big question. So many women wonder, what exactly is perimenopause or what is menopause? Can you like down the difference between perimenopause and menopause and how women can know which stage they're in?
Excellent question again. So, we always think about menopause, right? The average age is around 51, 52 in the United States. Perimenopause starts much earlier. So, on average for perimenopause, usually by the time you're 40, but in some women, it can start like around 35 or so, late 30s. Perimenopause is the roller coaster. So you just think about a roller coaster, meaning this is when your hormone levels, they start to go up and down, very unpredictable. So that's why for a lot of women, it's hard to say what the hormone levels are doing, especially when we think about estrogen and progesterone, because they are fluctuating broadly. You are then presenting with symptoms of low estrogen, high estrogen, low progesterone, high progesterone. And that's why when some patients, when you go and you ask your doctor, like, hey, can you just check my hormone levels and see what's going on? The textbook answer is we are taught to tell patients, well, if we check your levels, that's not necessarily going to help us. Just because I check it and your estrogen level is this high, I mean, a week from now, I could recheck it and it'll be down here, right? So it's not so much that snapshot in time, but it's more, how things are trending. I do tend to check around like day 3 of your period because then I know it's like, okay, this is the phase that you're in. You're at the beginning of your period, and these are the levels that I expect to see. So, perimenopause, again, just think about it's the roller coaster. Things are going up and down, varying so much.
I like the explanation of how it's supposed to be like a roller coaster, which is pretty cool. I think the question I'm hearing too, when you get older, you're more likely not going to get pregnant. We talk about fertility. And when that stage comes around, what do women need to know about pregnancy risk during that stage?
So perimenopause can last for a long time, a decade, sometimes a little bit more. You know you are likely in perimenopause once your cycle starts to change, right? So if your cycle was always like clockwork and all of a sudden it's shorter, instead of 5, 7 day cycle, it's like a 10-day cycle, 14-day cycle. All of a sudden you start skipping periods, you start spotting. So all of these different things, we do count them as a change to the cycle. So if you start experiencing that, you are likely in perimenopause. It'll be harder for women who've always had irregular periods, even when they first started in adolescence and teen years. It's harder for them because, their periods have always been unpredictable. But once it starts changing by a lot more than what you're used to at baseline, then you're probably in perimenopause. If some women are wondering, oh, I'm slowing down, there's no chance I'll get pregnant, there still is a chance if you're still ovulating. Ovulation becomes less predictable, but it's not completely gone. So, menopause is defined as the period where if you have not had a period for 12 months straight, that's when we can confidently say, yes, you are likely in menopause because you haven't had a period for at least a year. And there are labs that we can check to see if somebody has transitioned from perimenopause to menopause. So that's how you kind of think about it. Perimenopause, late 30s it starts, or it can start in the 40s. And then when you go into your early 50s and you're still having a period, but things are really slowing down, and then you don't have a period for a full 12 months, you have now hit menopause. There's some confusion about the word postmenopause. Postmenopause just means like today marks the 1 year since I haven't had a period. So then tomorrow And then that's when you're like, okay, now you're considered to be in postmenopause. But a lot of people use it interchangeably too, right? Like, oh, I'm in menopause, but pretty much the same thing.
I had that misconception. I'm thinking there's this whole stage of menopause.
Sure.
So to me, it was like, oh, it's a 1 day thing. I thought it was like this whole period of time because every time we hear it, like, I don't know about you, but growing up, it was, oh, I've only heard of menopause, not perimenopause, not postmenopause. That changed my perspective because it's just a quick thing. Menopause, like you said, it's a year after your last period. That is considered menopause.
Yeah, and that's a good point because I mean, so basically it's like the same process, but it's just different phases, right? Basically, we are aging, and that's fine, that's normal. But as we age, our hormone levels are also decreasing, and specifically talking about estrogen, progesterone, testosterone when it comes to the sex hormones. So over time, those hormone stores get depleted as it's going downward. That's when we're in the perimenopause or the roller coaster stage. And then once we are just like completely like we're done, no period for 12 months, and then we're in menopause. So then things kind of level off, but it's at the lower end. So things are slowing down, and eventually we get to a point where there's nothing left, or there's just a very small amount. But that's often not enough to keep up with the function. That's why a lot of women then have all these symptoms show up at that time.
And I think we're going to deep dive into some of the common hormones. Every time I hear menopause, it always had something to do with hot flashes. And I'm like, oh my gosh, that's like my sign for menopause. But and that's what we always hear in terms of hot flashes. But menopause is much bigger than that. When we talk about lower estrogen, the risk of osteoporosis, heart disease, how does menopause affect long-term health? And what are some other signs beside hot flashes when you're going through menopause?
Great question. So, estrogen, progesterone, testosterone, if we focus in on those three hormones. So, the estrogen will help protect your bones, protects your heart, protects your brain, protects your skin. Those are just some of the things that it helps with. So when the levels drop for estrogen, all of these risks go up. Risk of bone disease or osteoporosis, heart disease. So you're at risk for heart attacks and strokes. Brain health is affected. We start worrying about dementia, and then even your skin. So I tend to think about menopause as like a whole body shift. Sometimes we think, oh, it's more gynecologic, it's just the vaginal dryness. But like you said, with hot flashes, I mean, it starts affecting like even temperature regulation. It starts affecting all these other systems. So that's estrogen. When it comes to progesterone, we tend to think of this as like our, and I think you had this on one of your TikTok lives, and I'm like, oh, I like how she worded that. You know, it's like was it the sleepy hormone? But that's a really good way of remembering progesterone, because the more progesterone we have, progesterone will help with our sleep regulation. It keeps us calm, it keeps us balanced. Because of that, it helps to reduce anxiety. So this is kind of like our sedation kind of hormone. So progesterone, think of it as like the sleepy hormone. And then when it comes to testosterone, so testosterone will help with things like your libido, it helps with energy, and it helps with strength because it does help increase your muscle mass. Whenever we think about hormones in general, you know, there's things like thyroid, cortisol, there's insulin, and then these all get affected as well. But when it comes to the main menopause, perimenopause hormones, we tend to think about more estrogen, progesterone, and testosterone.
So, what are some other things that women can look for? Because sometimes, like when I'm talking to someone, and oh, I feel like my hormones are changing. Because that's the thing. Like, it's like, am I going crazy? What's wrong with me? Like, that's usually what I'll tell myself. Like, now I'm kind of learning a little bit more, but I'm curious how women that are watching the podcast, what are some things that they could look for to be the signs that I need to be aware instead of blaming ourselves that this is like, I'm going crazy.
Yeah, no, that's a fantastic question. And you're right. When we think about menopause, it's like, but I don't have hot flashes. I don't have night sweats. I feel fine. And because of that, not necessarily a misconception, but just like a lack of just education and knowledge on what to expect when it comes to perimenopause and menopause. Hot flashes and night sweats are just some of the symptoms. It could cause brain fog. A lot of women women, once they hit perimenopause and menopause, all of a sudden they get misdiagnosed, and maybe, not necessarily misdiagnosed, but all of a sudden they have a new diagnosis of depression, anxiety. And instead of treating the root of the problem, which is to address the hormone deficiencies, these women get put on antidepressants, right? Anti-anxiety medications. All of a sudden at age 40, you have like a new ADHD diagnosis because dopamine is also affected during perimenopause and menopause. So those are the mood disorders. Your sleep starts getting affected. It gets harder to fall asleep, harder to stay asleep. Musculoskeletal system, you start getting random aches and pains that you never used to have before, even in the absence of like an injury. You start having like rashes, just random things show up, numbness and tingling. You start having GI side effects too. Their gut starts getting affected. So a lot more sensitive when it comes to things like diarrhea and constipation. Weight distribution changes. All of a sudden it's, you're eating the same, you're exercising the same, but you just can't seem to lose weight. Like all the things that you used to do to maintain your weight or to lose weight, they're just not effective anymore. And a lot of this does have to do with the insulin resistance that comes about when you start perimenopause and menopause. All of a sudden, you start getting more weight to like your abdomen, that area, because there is a weight redistribution that happens during perimenopause and menopause. Yeah, and things like stress, you get more irritable, your tolerance for bullshit goes down. And people notice. And that's why it's good to know about these symptoms. It's hard, first of all, experiencing these symptoms, going through it alone, but especially if you don't even know what's going on. So that's why the more we educate our women, that way they can reach out and either connect with their friends, like, hey, are you experiencing this? I'm going through this. They can tell their partners because it's always easier to not go through it alone. So if you tell people like, hey, this is what's going on with me, so that way people can support you. That way you can be supported by your partner, your family, your friends, you and your girlfriends maybe going through it together. I feel like now we're starting to have this movement where more women are talking about it. You see it in these like menopause, perimenopause Facebook groups. Like, we're talking about it in Dear Suga because the more you know, the more you can actually do something about it. And it's not something you have to go through by yourself. And especially knowing that this is a natural process. Do I just suck it up and then just go through it alone? It's like, this is just how it's going to be. No, if you address the root cause, there are things that we can do. Hormone replacement therapy, for example, that you could tap into. You could discuss it with your doctor. There's so many things that we can do.
It's interesting because we go and we do blood tests to figure out and diagnose things. But when it comes to hormones, it's a little bit more difficult. So, first of all, we talk about hormonal imbalance. I'm like, great, but what does that mean? And then we start spitting out estrogen, testosterone, insulin. There's so many hormones.
Yeah, so it comes to hormone balancing. So this is kind of like a tricky phrase because depending on who you ask, there are some practitioners who make a living out of like balancing hormones. But when you think about it, it's really hard to balance because you're always trying to catch up with like, oh, estrogen is high at this time and then estrogen is low. Like it's almost impossible to balance something that you kind of don't have control over. But even though things are fluctuating, it's definitely fluctuating, but it's downtrending as far as those levels go. So symptoms and these changes, they are expected, but if the symptoms are so debilitating, then that's not part of normal aging. It should not be so debilitating that it's affecting your quality of life. And there are different kind of lifestyle tools that do help, right? So if we know that it affects sleep, stress, and that kind of thing, sure, you can focus on some strategies to help you with sleep, to reduce stress by exercising and just different things to help you relax, right? Meditation and things like that. But there's also a lot of talk about supplements. And one of the things that you had, it was talking about, oh, what about ashwagandha? What about all these other supplements? And I like to think of it as, so say your body is a car. And then in order for your car to start moving, to start working, we need gas in the tank. So as we go through perimenopause and menopause, like our gas, it's like almost empty. So in order for us to get the car moving again, we got to put gas in the car. And that's where hormone replacement therapy comes in, right? And that could be really life changing for so many people. And it makes sense, right? You put the gas in the car and then you get them going again. But when you think about supplements, so these are things like, sure, they can help make the ride more comfortable. Like if you put like air freshener, if you play music, if you have like nice cushions and things, right? So all of these things make for a nice, comfortable drive. But guess what? You could sit in like your nice fancy car and be comfortable and listen to your nice music, but that car ain't going nowhere if you don't have gas in the vehicle. So that's why it's like, unless you address the root cause, which is the lack of hormone levels, things are not going to get better. So you can supplement and do all those things, it'll help. But unless you're actually supplementing and repleting the hormone levels, you're not going to really see a big like clinical benefit from those things. I mean, they're not wrong. You can do it, but just know that HRT really is what needs to happen in order for you to see the most relief.
I know you're very allopathic, and but there's people out there that believe in naturopathic. When you talk about hormonal replacement therapy, HRT, what does that actually look like? When I think of that, I'm just like, isn't supplements like helping me internally? So what is HRT?
Hormone replacement therapy. So, well, the two main ones are, replacing estrogen because estrogen is low. You're replacing progesterone because that's low. But sometimes progesterone is added for other reasons, just to help with, again, sleep and stress and to help protect the uterus, especially if a woman is taking estrogen alone without progesterone, that can increase your risk for like uterine cancer. So, progesterone is there also just to protect that uterus. And then testosterone can also be supplemented or replaced or prescribed to help with things like libido and energy. So when I talk about HRT, I'm talking about actual prescription medication for those hormones and not supplements that can support hormone health. So when I talk about HRT, it's actually you can only get this from a prescription.
Well, that makes me think too. If I go in for my medical checkup, will the doctor really ask me, like, oh, I'm low on estrogen, I'm low on progesterone? I don't think I've ever heard that.
Yeah. Unfortunately, most doctors will not even know what to ask. And that's why a lot of doctors are now recognizing the just lack of knowledge, lack of training. And just because somebody has been through like residency, like even with like the OBGYN doctors, the endocrinologists, you would think that the curriculum would emphasize women's health when it comes to treating perimenopause and menopause, but there is like almost nothing. Like there's no training on this. And that's why, so it used to be called like the North American Menopause Society or NAMS, but now it's just called the Menopause Society. So a lot of practitioners now are trying to get that education that was missing from medical school, that was missing from residency training, learn more about it, and then get their certification so we can better help women because half of the world's population is women, right? And we shouldn't have to wait until women get so symptomatic that we're not helping them. And just because you're a certain specialty, and that's the thing. The Menopause Society has made it so any, practitioner or like if you're MDDO, you can go and you can get certified for it. It doesn't matter if you're a primary care doctor, like it doesn't matter if you're just like a women's doctor, OBGYN or endocrinologist, like anybody can really do it. Like I have like Dr. Rachel Rubin, she's a urologist and she's like at the forefront of this. And there are a lot of, primary care doctors that are now taking this on because primary care doctors, we are at the forefront of all of this. We're like the first line. When patients need to go and see somebody, you go and see your PCP, your primary care physician. So I feel like more people should learn about this. Otherwise, if patients don't know what to look for, if they don't know what to even bring up, and you see your doctor and your doctor doesn't know what to ask you and doesn't know how to treat it, it's such a missed opportunity. And then these women will then just go on to suffer in silence until they like see something on TikTok or they read about something, or their friend finds out and lets them know. Like, we need more opportunities for women to be educated on this.
And because you're here on Dear Suga listening into this podcast, that means you get to hear this. So let's say I really love my primary doctor, but I've never had this sort of conversation with my doctor before.
Yeah, it's always useful to bring in like either a log of your symptoms, and it always helps if you have been tracking things already, because doctors are very, well, everybody is different, but we like facts. For example, for me, if I'm following somebody for blood pressure, I'm like, well, let me see your log, versus if somebody just comes and says, well, I got this number on this day, and then I never checked again. I'm like, yeah, but I want to see the trends. I want to see what your patterns are. I want to see, what things are during what phase. So if you can start tracking, any of the symptoms, tracking your cycle, when did it start? How heavy was it? When did it end? And then do it day to day, even month to month, because the more data you have, the more, the more that people can pull from, the better it is for us to recognize patterns, and then once we have that information, the better it is for us to be able to come up with like a more robust treatment plan. But even if you go in with all of this to your doctor, and if it seems like they don't know what to do with this information, then it's fine. It's fine to get a second opinion, seek out someone who is able to help you, not just who's able to help you, but actually believes that, perimenopause is a thing, because some docs don't necessarily think that way. So if you go on the Menopause Society, menopause. They do have a section there where you can look up menopause certified practitioners just in your area. And I think you can just type in your zip code, and then you'll be able to look up somebody who is certified. That way you don't have to feel like you have to do so much convincing, right? It's good to have that at baseline. You should always advocate for yourself. And if you're not getting the help that you need from your current doctor, then find somebody else.
And I think that's a great thing. I love that portion about tracking, because the truth is, I don't think I've ever grown up having to track my cycle. I've had my cycle regularly and I'll know when it's coming. But lately, I've noticed there's a difference in my cycle. I did see studies that said women who track their cycle report like better awareness of their fertility and hormonal shifts. So, because we're talking about tracking in terms of tools that could help women prepare for these changes, what should they be logging?
Yeah, so there are actually quite a few apps out there. If you go, depending on what phone you have, you just type in like period tracker, menstrual cycle tracker. So many things will pop up, right? Like Clue, Flow is another one. A lot will pop up. But you don't have to use an app. It does make things easier. For me, I have my iPhone Notes app. It's called Symptom Tracker. So what I do is I just put the date, and then I put down something like, my appetite was really high today, or I'm feeling more anxious today than normal, or like last night was a bad night. I didn't get that much sleep. And that's a lot easier for me than to log into an app and then learn how to navigate. And they're always updating apps. So I get a little bit annoyed. It's like, wait, I used to go here, then I hate relearning things. So I'm like, no, I'm just gonna go on my Notes iPhone app and then put in the date, and then put in whatever symptoms I'm having. And that does include things like, I'm irritable today, and today this happened, and like I wasn't very hungry today, or it was hard for me to focus today, because that could tie to brain fog. Do something that's easy for you, and as long as you have it all in one place, that way when you show it to someone or when you share it, they can easily access it, or you can print it out for them and show them.
I mean, the reason why I'm just kind of smiling and laughing here is because I'm in my AI phase right now where I'm logging everything on ChatGPT. Some people will agree, some people don't agree.
That's
So
your bestie.
that has been my thing. But you have something that you enjoy doing, like when we're talking about questions that they might have about hormones or things like that. You have a pretty good thing. So I'm going to let you talk about that.
Oh, yeah. So we call it like a perimenopause menopause questionnaire. And I like it because it's Basically, it's a list of symptoms that I give patients who I'm treating for perimenopause, menopause symptoms, right? So every few months, they get the same questionnaire and then they go ahead and then mark how severe their symptoms, like, oh, yeah, this is happening to me all the time, or, sometimes, or not at all. And then I then like to look at the different trends, right? So it's like, oh, well, since you started estrogen, like, see the symptom. When I first met you, you said like this was really affecting your quality of life. It was happening like every single day. And now look, slowly over time, these things have improved.
Go put a link in the description. I think that's pretty cool because, like you said, like it has to be something that eventually become a habit. I love that we can give the resources, but it has to fit your lifestyle and how you're doing things. For you, it's notes. For me, it's putting it in ChatGPT.
I love to type and text, and I know you'd rather chat, and then sometimes you don't even chat, right? When you talk to ChatGPT, yeah, yeah, you full on are just talking to them, right? So you're a chatter and I'm a texter. So whatever works for you, you just do it. And it's good to share that too, right? So even if you put the link and then that way, like your viewers can read through it and be like, okay, so these are the symptoms that I have to watch for. And then they'll have something, like physical data to take into their doctor to show them like, hey, this is what's been going on with me.
Yeah, but here's the thing. I think this is something that could be difficult because I use AI a lot. You use Perplexity. If that's
I
your
love
thing.
perplexity.
Yes. And so the thing is, like, a lot of us, especially women our age, like millennials and so forth, we're looking for resources. And sometimes we'll self-diagnose ourselves. And that's what I'm worried about. And so it's just kind of like caveat, these are all resources, but it's always good to go and seek professional help when it comes to hormonal imbalance.
Love that. I love that you brought that up because I should say that, even though these hormone changes, fluctuations, they are happening, we also don't want to miss anything, right? So because it's true, like you could have some kind of other underlying issue that has nothing at all to do with like estrogen, progesterone, and testosterone. Like maybe your thyroid levels are off, or it's like Hashimoto's or something. So we don't want to put all the blame on these hormone imbalances. That's why it's still good to go in, get a comprehensive evaluation, that way they can screen you and make sure they rule out other things that could be going on. That's why it's good to go in, get tested, make sure the due diligence is done, rule everything out, and then focus on treating what we can treat.
Yeah, that's a good point. So, but it's good that we put that out there. And so we are just scratching the surface here. One of the things that I feel or think when having conversations about sex is all about feelings. And I think there's always like an emotional attachment to it, but not necessarily in terms of how your body is performing. Stats have shown that a lot of women don't orgasm every time they have sex. And women probably never even experience what an orgasm is. And so the thing is, like, instead of that feeling of sex, talking about feelings, but try to talk about a little bit about the science behind it and some of it having to do with hormones when it's your arousal and orgasm. What's the science women should know about their bodies during sex that often gets left out of conversations?
Yeah, so that's a great question. And I will preface this by saying that I am no sex expert. And when it comes to like our curriculum in med school and residency, this is not something that is really heavily emphasized, but it should, because now I think they're trying to, I know Dr. Rachel Rubin is trying to create like a sexual medicine fellowship, which is amazing because I mean, that affects everyone when it comes to sexual wellness and sexual health. So it's too bad that we don't have enough education on this or enough training on it. But so when it comes to the science of it, or from what at least I was taught, right? So arousal is definitely a big mental mental thing, right? So, but at the same time, it's not just mental, right? So a lot of hormones are playing a part, and also vascular, right? So it's hormonal, it's vascular, it's basically it's biology. So when you think about arousal, there's a lot of blood flow to the area, and not just blood flow, there's also like nerve sensitivity that goes up, right? So that's why like the sensation tends to be more heightened, and the hormone levels are also fluctuating. So all of these things play a role. So when things are not quite working right, like for example, if they used to work better and now all of a sudden there's a change, so it's important for women to know that, it doesn't mean that you're broken. It's biology. So there's a way that we can support this. And if we know that, you just have to talk about it, because if you don't bring it up to anyone, then it'll be almost impossible to treat. There are some medications out there. You know how men have like the Viagra and all these other medications, right, to help with like erectile dysfunction, to help with arousal. Women don't have quite as much, but that is changing. So we have things that can be applied topically, different medications that can actually help with not just arousal, but also orgasm, because there are women who it's like a physiological, like it's a disorder that can't orgasm. But it's good to know that we have options available, because sex is important. It's just as important as like our mental health, physical health. And if things aren't good in that department, that can start affecting the other aspects, right? It can affect your mental health, your physical well-being. So this is a topic that should not be ignored.
One of the things that happened, you had like a workshop with Her Space,
Yeah.
which is out in Lacey, which they had a session with you where you came in and you had like a group of women attending this that you've had, and you
Yeah.
actually created some samples. What was the samples again?
So yeah, we had different things that we were giving away, some little like face masks, things for skincare. Also, we gave away some like lubricant samples, packets of gel, arousal cream, for women to try. But yeah, it was great. We had some women from the community show up. We had a good discussion at Her Space just to get the word out there. It's more educational and it's totally free to attend. So if anyone's listening and they're in the Lacey, Olympia area, definitely keep an eye out on those announcements for any future workshops.
Yeah, and I know that they don't just do these workshops. So if you check them out, they're doing an awesome thing out there. So
Yeah.
we go back to that whole thing about sex. I think for me at this point in time, it's just more of a mental thing, and I think it's just something to do with past relationship traumas. I guess the thing with sex, it can be sort of like intimidating at times, right? It's
Mhm.
biological, but it also can affect your confidence. And so, in terms of like self image, weight, skin, all of that impacts intimacy. So, how do these shifts affect confidence in relationships, and how can women talk openly with their partners about this?
Yeah, and you're right, because now that we've talked about like the different hormones and how they can start affecting your body, right? Like that weight redistribution, weight gain, it's harder to lose weight. A lot of hair thinning, a lot of women start losing their hair, skin changes, all of these symptoms are real, and it can really mess with your self-esteem. So if this topic is brought up in clinic, I always encourage women to, get educated on it and know that, this process, because of the hormone levels, being affected, this is something that we'll likely start seeing. So talking openly to their partners, having that communication, like, hey, this is what's going on with me. This is what's happening to my body. Mainly so they're aware, but also so they can support you, right? So again, this stage in life for all of us women, it's so hard doing it alone. So if you could let your partner know, it's so much easier to get that support from them, and that way you yourself don't feel alone. So just basically just having that discussion, don't be afraid to bring it up. And hopefully you have that kind of safe relationship with your partner that you can talk about these things, because depending on the dynamic, because I've heard women say like, oh, but I don't, like, they've been with like their partner for so many years and they're still uncomfortable bringing up something like that. So hopefully it's that kind of relationship where you feel safe enough to bring it up.
And the thing I love about Dear Suga, especially with those that on TikTok, I love that it's not just women that are part of Dear Suga. There's also men that are on here, and it's beautiful to see. It's like being able to understand a woman when she's going through something, especially because instead of just saying, "Oh my gosh, her hormones are off," or "She's just the way it is," it's like more educating yourself. And if this isn't for women, this is also for men.
Mhm. Mhm. I love that panel that you had, and I think like one of the women on the panel, weren't they sharing that they were even starting to teach their sons, right? So like, hey, because it starts at a young age, like, and I know we're talking about perimenopause and menopause, but I mean, even as kids, that's when we start having our periods, depending on whether or not your parents or somebody prepared you for what a period is and what to expect. Maybe they're that conversation never happened. So hearing her on your panel say like, yes, I'm even telling my sons, if you see a girl and they're on their mai, and you see like there's a stain or whatever it is, go and help them. And I know that for some women too, they're like, oh yeah, they always carry extra in their bag, just in case something like that happens to a woman in their life that they know. So it's good, and I think these things should be openly talked about. Because I know, like with our society, we're very conservative growing up in American Samoa. So you have that sacred space in between everyone, really, whether it's between you and your siblings, between you and your parents. There are just certain things that are not discussed in the same kind of vein. Yeah, but when it comes to this specific topic, I think there should be an overlap when it comes to addressing just women in general, because we can't do it alone.
Yeah.
So I'm happy that with your platform, I've seen people come in and in the chat, and they're men, and they're present, they're supporting, and they're also advocating for their sisters. So
Yeah.
that's a beautiful thing to see.
Yeah, it's not even their sisters, their daughters. It's like
Yeah,
they
yeah,
come in, they're
women.
talking about, hey, I want to be able to empower. I love these platforms because I have a daughter and I want to be sure that I can learn to help support them. That's beautiful to see. And so that's just a thing because we're talking about our Samoan culture. And sometimes, as a Samoan, we're very used to like, what do we say this? Sarcasm is such a big thing in our culture. And
And
so
aamu.
Amufa solo ako. And so
Yeah,
sometimes, growing up, it's like you sometimes will fama you or like when you're on
yeah.
your period and you're like, oh my gosh, what is happening? Ew.
And the guilt.
Instead of, are you okay? Can I help you? Like, instead of putting someone down and just making them feel horrible of what they're going through, which is a natural thing in our bodies.
Yeah, yeah, and that's unfortunate because we do see that a lot, and we even recognize it and we joke about it. It's like, oh
Mhm.
yeah, only Samoans, somebody falls down, instead of saying, oh my gosh, are you okay? First we laugh, and then we're like, oh, okay, maybe somebody should check on that person. It's like amu first and then help later.
Yes.
It starts really young, because if you're a kid and you see that around you and everyone is doing it, it's like, oh, okay, that's just the thing to do. But there are people who really need help, and there are people, like, if they're a victim of that, they go home and they just it stays with them. So
Yeah.
be nice.
Yes, be nice. Just to kind of turn it around. The beautiful thing is that I think that's what builds our resilience. So I think that's what makes someone's.
True. I love that. And I've seen that. It's like, there's no way anyone can offend me.
I've
Whatever
been
bad
through it.
thing you're about to tell me, I haven't already been through. Like my brothers already said that. My parents already did this. I have thick skin now.
Yes. It's kind of interesting because I think our generation is in between generations. So we're trying to bridge it and just make sense of what's transpired in our past and make it better.
You're right. It's like we want to lead with kindness, but we also want to raise the next generation to be strong and resilient, decent human beings. And you
Yeah.
see that, well, you've seen how I try to raise Zoe too. She's only existed for 4 years, like her ability to regulate her emotions. So it's remembering that and
Yes.
reining it back.
Yeah. And then you're consistent. I think you're doing
Yeah.
awesome. Talking about Zoe, we're talking
Mhm.
about this whole pink tax. Funny thing is, because we were talking about hair growth and how Rogaine, for example, if it's women's, there's a women's Rogaine and there's a men's Rogaine. So I heard from another dermatologist, there's no difference. First of all, there's more minoxidil in men, and it's okay for you to use it, and it's going to be cheaper. And what's crazy is a lot of things that might be the same thing and how it's marketed. And so that's the thing for women. So pink tax, do you want to kind of touch base on that and how that plays with
Yeah.
women's health?
Like, I feel like this society and all these like companies, they love to take advantage of women's wallets. Sometimes it's like the exact same product, but they just put it in like a pink box or something. It's like, oh, this is for women. I'm like, how come the men's razor is like, a couple bucks cheaper? And then I feel like it's the same razor, but it's like pink now. And yet, just go like it's a lot more expensive. There's definitely a lot of like exploitation when it comes to consumerism or these businesses targeting women. They're smart to do it because there's so many products, not just there's so many products that are specific to women, right? Like the menstrual products,
Yep.
pads, tampons, menstrual cups, like all these different things, like bras, razors, menopause products. So many things that are not unisex but specific to women that people can just make it pricier. It's expensive to be a woman these days, and a lot of these products are not necessarily even covered by insurance. But I think there is a movement, right? Like if you go to certain bathrooms now, they have hygiene, feminine products there. Like they have pads, tampons that are free to use. And I wish more businesses will have this. That way we can access these things just like how we can access toilet paper. Can you imagine going to like a toilet and it's like, oh, I had to bring my own toilet paper? So I wish that would be the same case for like, the menstrual products, for
Yeah.
example. Yeah, but I feel like so we definitely need like better access, and that probably starts with like policy change, because I mean this really does affect basic care. Women's care is basic care, and it should be widely available.
I think I'm just going to insert a little bit, especially when it comes to menstrual products, especially like if you have HSA or FSA, you can actually use that to purchase your menstrual products. We did a discussion in the past in terms of periods, and we were talking about the different things like the menstrual disc, the menstrual cup. And I'm like, no, I'm not ready for it. I tried it and I'm like, oh, it's the comfortability there, but just know
Yeah.
that it's out there. But yes.
Period panties, right? That was the other one.
Period
Period
panties? I
panties.
actually enjoyed the period panties.
I didn't like that.
With the pad, I had to put the pad. I feel like it's a good thing if someone said when I even like laugh a little bit, then especially after you're pregnant and when
So
in
so
leakage.
real.
So
Yeah.
I feel like those are actually pretty good to have.
Yeah. Well, and then the other thing somebody brought up during the panel too was just like when things are really heavy, even like the heavy overnight pads are not enough. So they'd have
Yeah.
to wear like a depends, right? Because that has like the most support. So
Yeah.
yeah.
And,
But
and
it's
if you're a
great.
woman, yeah, and if you're a woman, you know that you're just like, oh my gosh, I have to sleep right. Figure out how to sleep
Yeah.
without having to. These are real
Yeah.
problems.
They are. And then you'd have to buy extra products, right? So they're like waterproof mattress covers because if it leaks through and it's like, ah, my bed is ruined, the sheets are ruined, and you always have to change and wash and dry them. But if you have like, or even those incontinence pee pads that you use for like dogs and pets, like the blue chucks, yeah, you can use that too. But see, like just because you're a woman, you have to buy all these other products that men don't necessarily have to get, but the cost adds up.
Yep, I agree. So we've had such a great discussion today, but we're also kind of running on time as well. So this brings me to our last question. When you're a woman and you self-advocate in healthcare, you're more likely to receive early diagnosis and treatment for for
Yeah.
hormonal issues. If you could leave women with one empowering message about advocating for themselves and embracing this stage of life, what would it be?
Yeah, so advocate for yourself. Always ask questions. Don't be afraid to ask questions. Come prepared. Go prepared to your visits. Show them your logs, track everything. And if they're not responsive, push for a second opinion. Go see someone else. It's totally fine to do that, and just continue tracking and bring your notes because you know your own body, and you're like the best person to provide that information to your doctors. And just know that just because perimenopause, menopause, it's, a natural process, you don't have to suffer through it. And if you're having symptoms and if you feel like I'm going crazy, what's going on with me? You are not crazy. It's just biology, right? You're not crazy. You're not alone. You deserve support. You deserve treatment. So knowing where to go and how to access that support will make a big difference. And I think you'll put the link down for that Menopause Society, right? So if people are interested in kind of looking around in their area to see where the expertise is, they'll be able to look that.
Awesome. I think that's a great way, like, to summarize our discussion for today. Dr. Tui, thank you for always bringing your support, your expertise, your honesty, and most of all, your heart into this conversation because you care about people, and it's the reason why you go out and you learn as much as you can. People don't realize this, but Tui can spit fire. She's very passionate about things. I'm so fortunate to see it. And I know that more people hopefully can take away our conversation. So to all our Dear Suga listeners, I hope today gave you not only answers, but better questions to take with you to your doctor, your friends, and for your own reflection. Because that's what Dear Suga is all about. It's real conversations that help us understand, prepare, and thrive. Until next time, with all my alofa and mana, take care.
Bye.